In this video, we're going to look at the causes of mental and emotional health issues. We're looking at anxiety, affective, and personality disorders, some of the primary ones of those, and then what are the major symptoms, what to look out for, and the basics on how to seek treatment.
An anxiety disorder is a serious mental illness. For people with anxiety disorders, worry and fear are constant, overwhelming, and crippling. It can be very, very tough. Anxiety is a normal emotion that everyone has, but somebody with an anxiety disorder will have so much more severe. They'll have problems at work, problems taking a test, problems making decisions, and this can interfere with them having a normal life. So everyone has anxiety. Somebody with an anxiety disorder, it really interferes with their normal life. Some different anxiety disorders include panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, social anxiety disorders, and then very specific phobias. And looking at some phobias, on the screen I have some of the characters who have played in movies and books and such who have different phobias. And these people have a panic and dread or a horror of what they're afraid of. It goes far beyond normal fear. Now I don't want to be bitten by a snake, but I'm not paralyzed if I see a snake. That's sort of the difference between a healthy fear of something and just a true phobia. Somebody with a phobia, they become uncontrolled. It basically takes over the person's thoughts and actions. Symptoms would be a rapid heartbeat, shortness of breath, trembling, and an overwhelming desire to flee the situation. And these people will take extreme measures to avoid what they fear. Obsessive-compulsive disorder, these are people who will focus on one thing and can't not focus on it. Again, I have some of the movies who have characters with this on the board. They are people that don't wash their hands one time, but might wash their hands many, many, many times before they eat. Or everything must be exactly in its spot in the room, or they're stressed out if one little thing's out of place. There's many different symptoms and different ways that people show this disorder, so it's hard to say everything. Hoarders are one, people that just collect everything and just refuse to throw anything out. These people often have rituals, and they need their rituals. It's not just like they usually drive to work at about the same time every day. They have to drive to the same work every day. Again, it varies for person to person. Panic disorder, these people have sudden and very intense fears and anxieties. They might pass out, shortness of breath, blurred vision, dizziness, and racing thoughts. So they'll be doing okay, but then all of a sudden just an intense anxiety. Post-traumatic stress disorder, this is where the person goes through a very traumatic event, such as a war, maybe a policeman in a firefight, a gunfight, a firefighter who has to barely survives as they fight a fire or save somebody. Well, then they will have reoccurring flashbacks of this, possibly started by something that reminds them of it, such as a loud noise, or it could just happen. They'll have intense fear, a heightened startle response, which means they're very jumpy, startle, and these people obsess over these and have nightmares and oftentimes the flashbacks.
Affective disorders, there's quite a few. We're really looking at the bipolar and the clinical depression, which are two different things. They have multiple aspects, including biological, behavioral, social, and psychological factors. The symptoms range from mild and inconvenient to severe and life-threatening, and 15% of all suicides are related to affective disorders. So 15% of everybody who commits suicide has an affective disorder. On the screen you'll see on clinical depression different characters on TV shows and movies who have clinical depression. And depression is a depressed mood, such as feeling of sadness and emptiness. They'll have a reduced interest in activities that they used to enjoy, oftentimes a sleep disturbance, which means they might not be able to sleep well, or they're sleeping way too much. They'll have a loss of energy and a significant reduction in energy level. They'll have a difficulty concentrating, holding up a conversation, paying attention, making decisions, and and they'll have a hard time making decisions that used to be easy to do. They'll sometimes have suicidal thoughts or intentions. They won't necessarily have all of those symptoms, but some of those. Clinical depression is not just being in a bad mood for a day or feeling down for a weekend. It is an ongoing, long-term depression or sadness or lowness. Bipolar disorder, and here you'll see a few characters in movies and such that have had bipolar. It's the same thing as manic depressive, so the two terms manic depressive and bipolar will be used interchangeably in this class. In this, they'll switch from mania to depression, so they'll go from very high to very low. Bipolar disorder or manic depressive is not just extreme clinical depression. A lot of people in previous years have gotten these two. They think that this is just depression but worse. That's not the case. It is switching from mania to depression, and mania being a real high. Mania would be an elevated self-esteem, being more talkative, having a flight of ideas, not needing much sleep, easily distracted. And these people often have, they'll often spend more money than usual, sometimes even be involved with dangerous sexual behavior and or use of drugs and alcohol. That's the mania. That's sort of they'll be flighty, they'll be oftentimes talking fast, moving quickly, look like they're a bundle of energy, and then they can quickly switch to depression, which is the opposite. That's where they look very low, they seem to be depressed, very always want to sleep, can't seem to get up and do what needs to be done. So it's switching from the real highs to the real low. We're looking at the mental illnesses. As a whole, these personality disorders are mental illnesses that share several unique qualities. They contain symptoms that play a role in most, if not every, aspect of the person's life, and these symptoms will remain relatively constant. Personality disorders are a group of psychiatric conditions in which a person's long-term behaviors, emotions, and thoughts are very different from their cultures. These will cause problems with their relationships and at work. You'll see, observable behaviors will be present for a long period of time and are inflexible, so the person can't just stop doing this behavior. And these behaviors are not a result of alcohol, drugs, or another psychiatric disorder. To be classified with one of these disorders, the person must have at least two of the following. It must be evident in their thoughts, their emotions, their interpersonal functioning, and impulse control. Now, looking at antisocial personality disorder, I have several movies on the screen that have examples from movies you might have seen, might not have. And like other personality disorders, antisocial personality disorder is diagnosed based on a psychological examination of several symptoms. To be diagnosed, they must have these symptoms during childhood. It can't just develop later on in life, although they wouldn't necessarily been certified at a very early age. Though, as an adult, a therapist will look back to the childhood to see if they had some of these behaviors while they were younger. Antisocial personality disorder is a type of chronic mental illness which affects the way somebody thinks and perceives situations and what they perceive as normal, which most definitely the rest of the world does not, and these behaviors will be destructive. People with antisocial personality disorder typically have no regard for right and wrong. They will violate the law and the rights of others and will often get in trouble. Many of these people are in prison. They will live and behave very violently, and this lifestyle will often lead to drug and alcohol problems. People with antisocial personality disorder may not be able to fulfill the responsibilities that would allow them to keep a job, keep a family, and stay in school, which is what typically leads these people to be incarcerated. Antisocial personality disorder is sometimes known as psychiatric, sociopathic personality disorder. You might have heard them called sociopaths. A psychopath is a particularly severe form of antisocial personality disorder. The symptoms will have a pattern after about the age of 15 of severe disregard for the rights of others. They'll have a failure to conform to the norms of society. They'll be very impulsive, lots of outbursts and irritability, often physical assaults. Some argue that somebody with antisocial personality disorder does not feel empathy for other people, and the inability to see how other people are feeling hurts and concerns them. The hurt and concern of other people will turn into when the person with antisocial personality disorder, they don't see the hurts and concerns of other people, and this is seen as a disregard for other people, and they don't really regard the other people as highly as they see themselves. And they will have a lack of remorse for their wrongdoings. In other words, they will do wrong, but they do not feel guilty or feel bad about doing wrong. The borderline personality disorder is a very interesting one. They'll have a very severely distorted self-image. The way they see themselves is not really how other people see them. They see themselves as worthless and fundamentally flawed. They'll have impulsive and angry mood swings, and what happens is they have very unstable relationships. They will feel worthless about themselves, and they want to bring other people to them, so they will latch on to somebody and make them feel very good about themselves. So they will cling to another person and maybe give them gifts, be nice to them, that sort of thing. And then they become too clingy, and then they will start having behaviors where they will start pushing the other person away to see just how close they really were to them. And then the other person will get annoyed and frustrated by this and will leave, and then the cycle restarts where the person with borderline personality disorder feels all alone and needs to restart and will go back to that person. Oh, I'll be your friend, I'll do this, I can change, promise them everything, and will live up to that for a short while and then slowly start testing them again and slowly drive them away. Once they're driven away, the cycle restarts and they bring them, reel them back in. It's kind of like a yo-yo, bouncing, pushing a friend away, bringing them back in, pushing a friend away, bringing them back in. Very unstable relationships. And schizophrenia is not really how it is in the movies. Of course, I have some examples of movies on there, but it's not as, I guess, entertaining as those are, where a person sees one thing and really something else is going on, or sometimes they see themselves as character A and then sometimes they see themselves as character B. It can be delusions, hallucinations, thought disorder, and disorganized behavior. I mean, it might be just they see something that's not really there, not necessarily that they have an entire new personality. A positive symptom is one where they have an excess or distortion of normal functions. A negative symptom is they have the absence of characteristics of normal functions, such as a negative symptom could be the loss of interest in everyday activities, appearing to lack emotion, the reduced ability to plan for or carry out activities, or neglect of personal hygiene. Then there's also cognitive symptoms as well. These involve the thought process, and they'll have problems with making sense of information, problems paying attention, and problems with memory. And when you think about something like paying attention to memory, I mean, that can tie into ADHD. Does somebody with ADHD necessarily have schizophrenia? Absolutely no. So that's where you have to really look in depth at this. Somebody with schizophrenia who are teenagers, you can see them withdrawing from their friends and family, a drop in performance in school, trouble sleeping, and irritability. They might be, but a teenager would be less likely to have delusions and more likely to have visual hallucinations. Narcissistic personality disorder is a mental disorder where they have an inflated sense of their own importance and need for admiration. they have to have attention at all times, and often with little regard for other people's feelings. So they will put down others to make themselves feel better. The absolute need to be the center of attention. Not the want, or not that they like attention, they absolutely need the attention. This is very different from having strong confidence or strong self-esteem, because with the narcissistic personality disorder, they'll have the little regards for other people's feelings. Those with narcissistic personality disorder will over-exaggerate achievements and will feel very important. They'll often demand praise and admiration. They will set unrealistic goals for themselves and can become very depressed and very upset if those goals are not met. And they'll have a sense of entitlement, like they deserve to be the best, they deserve to get things that other people don't get. And they will often steal away the spotlight if somebody else is getting attention. They'll find a way to get the attention themselves.
Anorexia nervosa is the first one we're going to look at. And this is an eating disorder which is characterized by the weight loss of 15% of the body weight. Now, these people usually have a devastating fear of weight gain, and their dietary habits prevent the weight gain, and this will potentially be life-threatening. Looking at the DSM-4, which is how the mental disorders are characterized, anorexia nervosa is defined as the refusal to maintain body weight of about 85% of predicted. So they refuse to keep their body weight where it's supposed to be, healthy weight. They're too light, and they have an intense fear of gaining weight and an undue influence of body shape or weight on self-image. They often have missing at least 3 consecutive menstrual cycles. Now, of course, other things can cause missing menstrual cycles, but when you have those factors in together and the 3 consecutive, that's the big indicator. And these people have an increase in morbidity, and mortality is present, so it is deadly. You can die from anorexia. It is frequently between the ages of 14 to 18-year-olds and women or girls, but can be any age. Definitely can be any age, and it can be both genders, men and women. Only about 50% of patients completely recover, and some studies have found 10 to 20% can die from it. So it can be very deadly. Some studies have found it's not quite as high as that, but it definitely can be deadly. As far as factors that cause it, typically the female sex is 90%, and 10% involve men. A family history of eating disorders can be a factor that factors in. Perfectionist personality is an indicator. Difficulty communicating negative emotions, difficulty resolving conflict, and low self-esteem. When a person has all of these, they are more likely to get anorexia nervosa, or even some of these, not necessarily all of them, some of them. Complications, obviously you see them on the screen. You can more likely have dental problems. They're not getting the calcium that they need, and they're not eating that. They're also not getting the other nutrients they need, so they're weak bones, more likely to have injury, broken bones, something like that. The teeth problems. With cardiovascular system, they're more likely to have the hypertension and arrhythmia. They can affect their endocrine system and the metabolic system. It can delay puberty, affect their growth, osteoporosis. In their reproductive system, it can affect infertility and low birth weight. GI system, gastrointestinal system, it can delay, make it so that they have problems having a bowel movement. Also constipation. Neurological system, it can affect that as well. It can also make it so that the person has dry skin and hair and other hair problems. You can have renal problems, and overall it just really affects just about every body system there is. The causes are unknown, although we do know there are genes and hormones which are different, and social attitudes are different. Many factors are probably involved, and the genes and hormones play a role. The social attitudes of very thin body types may be involved. I have some pictures of some famous people who have said to have anorexia, and I tried to find pictures where the person admitted to it, where the person said, yes, I have this, and they use themselves as an example so other people can learn from them. So if you're wondering where the pictures came from, Audrey Hepburn here, very famous from back in the day. The risk factors are trying to be perfect and over-focus on the rules, being worried about or paying more attention to weight or shape than other people. Oftentimes somebody with anorexia see themselves one way while everyone else sees themselves another way. They might see themselves as fat where everyone else knows that that's not the case. Certain culture or cultural ideas about health and beauty factor in. Having negative self-image and having anxiety disorder as a child are all risk factors. As far as treatment, sometimes the person can gain weight once they're trying to gain weight again, or can gain weight through increasing social activity. Oftentimes they'll have to reduce the physical activity. Some people with anorexia just exercise for hours and hours and hours a day. That typically needs to be cut back if we're going to gain some weight. And using a schedule for eating. So they make themselves eat every couple hours. The person chooses to eat, I should say. A lot of times, if it's severe enough, a hospital stay is needed, and oftentimes a hospital stay is needed if the person is below 70% of their ideal body weight, if they have severe or life-threatening nutrition issues. Sometimes they need to be fed through a vein or a stomach tube if the malnutrition is severe enough. They'll also need to be hospitalized if the weight loss continues even with treatment, and or if the person is suicidal or very depressed. Looking at bulimia, again with the pictures, I try to find ones where the people have admitted to it. Some of these include Paula Abdul, Lady Gaga, Princess Diana, Sharon Osbourne, Amy Winehouse. The criteria for diagnosis in bulimia include a preoccupation with eating and overeating large amounts of food in short periods, which is binge eating. So binge eating is overeating large amounts in short periods. And then that binge eating is followed by an inappropriate behavior to avoid the weight gain, typically self-induced vomiting. But it could also be taking a laxative or a diuretic or excessive exercise. So binge eating a whole lot, and then doing something to counteract that. Typically self-induced vomiting, but it could be taking something to laxative, which gives you diarrhea, or the very excessive exercise. I don't mean the healthy exercise, I mean very, very excessive. Bulimia is predominantly found in women and is virtually non-existent in non-industrialized countries. So a third world country doesn't really have that. It's because they don't have the big focus on weight and looks. The factors are probably psychological, cultural, environmental, and societal. So all those factor in, psychological, cultural, environmental, and societal. Family problems factor in as well. And participation in extracurricular activities that emphasize the body shape and body image affect the development of bulimia. An example of that would be dance. Dancing, weight is very important. Often, sometimes the dance athletes are weighed, and if they weigh too much, they are no longer able to participate in the dance. So that can lead to this. The GI system is affected by overeating with binge episodes. This overeating can stretch the stomach and delay the gastric emptying, so it delays the bowel movement. Pancreatitis can occur. Cardiovascular problems. Let's see. Death is a little less common. It's not that common for bulimia, so fortunately most people don't die of it. Different studies have shown different things, but about 0 to 3%, so really less than 3% of those with bulimia eventually die of it. And about a third of patients who seek treatment for bulimia have past histories with anorexia nervosa. So unfortunately, somebody with bulimia might have also struggled with anorexia. Remember that first they have the binge eating, where that's where they eat a whole lot in a short period of time, and then they'll have a lot of exercise or forced vomiting, or they'll take laxative, diet pills, drugs that cause vomiting, diuretics. Oftentimes you'll see these people regularly go to the bathroom right after a meal. So they'll go to the meal, they might politely ask to go to the bathroom, and then they go in there and force themselves to throw up. Oftentimes these people can be identified with the broken blood vessels in the eyes, which is from the strain of vomiting, dry mouth. There's a little pouch that in the corners of the mouth due to the swollen salivary glands. They'll have rashes and pimples, and don't rush to conclusions when you see a teenager with pimples. Obviously, that's just one of the factors, or one of the signs. And small cuts and calluses across the tops of the finger joints, which are from forcing themselves to vomit. As far as treatment, support groups are very helpful. Cognitive behavioral therapy, and also taking antidepressants. All can be very effective.